Good afternoon. I'm Kevin S. from Vanderbilt University in Nashville, Tennessee, United States. I'm so sorry I am not there with you today, but I'd like to give you this lecture about COVID-19 and vaccinations relating to neurological complications. This should be the third talk by now you've heard on this topic. We had originally designed to do a little bit of a mini symposium at the conference. Dr. Guthrie should have talked already about COVID-19 in the neonatal intensive care unit, and Dr. Jundi should have talked about COVID pneumonia by now. So let's talk about the brain. This is not too surprising that this is a topic. The really quintessential symptom of COVID-19 when people think about it is loss of taste and smell. Those are cranial nerve brain findings, so it's not surprising there's neurological involvement. And then as a matter of disclosure, I do have both a disclosure to give, but also a background perspective. I, for the last several years, have been on a CDC panel in the United States to be a neurologist subject matter expert to review various concerns about vaccine side effects. And we evaluate the available data, see other trends and patterns that are emerging, and try to see whether something is truly causative or just associated. Over the years, it's been all vaccines, but the last couple of years has been all COVID vaccines for the most part. So a lot of experience thinking about neurological issues in both COVID as well as vaccines directed against SARS-CoV-2. So the overview of my talk today will be to talk a little bit about the most common neurological manifestations. A lot of this data is published for adults, but there is some pediatric information as well. And then talk a little bit more specifically about what we think is some of the signals that are coming up in our surveillance of neurological associations associated with vaccines. And again, there's going to be a bias here in terms of the vaccines used in the United States. And for the most part, these are the Janssen's, the Johnson & Johnson adenoviral-based vaccine, as well as the most commonly used mRNA vaccines made by Pfizer and Moderna. And I'll talk about those because it gives us an opportunity not only to think about adverse reactions against vaccines, but compare them to one another and see if there is a common thread or, again, distinction between these different vaccines that are being used. And it's important to talk about both COVID-19 neurological manifestations and vaccines in the same talk because there is a lot of overlap in how patients present. So the concepts to discuss are really about pretty diffuse neurological involvement, which makes this hard. There's various subtle symptoms that can come into play. It's not always clear. Some patterns, however, are emerging, and I'll describe a couple signals that have come from our post-marketing surveillance. And then, again, just really compare patients who had vaccine possible associated reactions versus the risk of having the exact same neurological concern as a manifestation of COVID-19. So as most things in science and life, it's about weighing this. But overall, be clear that the evidence strongly, highly supports vaccination to prevent neurologic disease as well as other diseases as well. So moving forward, the manifestations, again, these can be just thought of as what we've seen in the first few years of the pandemic, both minor and major criteria. I already mentioned this, to me, very quintessential loss of taste and smell, which when you have it is a pretty strong sign that you have COVID-19 infection. I've had it twice so far and did not lose my taste or smell with either one, but when patients present with that, we've all learned that it's very, very likely to be COVID-19, especially in the Omicron age that we're in. Other minor things, headache and fatigue, obviously very nonspecific and can really be due to many other manifestations. So hard with that to know what's going on. Now the major issues, things we have seen have been cataloging throughout the world, are listed on the left side here of my slide. Stroke is really important, obviously very devastating event when it happens, and we see much more stroke, especially in younger people in general. And this is thought to be due to the virus directly attacking endothelial cells, possibly altering the coagulation cascade, but definitely in patients present with stroke, particularly people who don't have other risk factors, COVID-19 is being suspected more and more. Some other neurological manifestations include encephalopathy, simply having pretty dramatic altered mental status, more than just the brain fog or alterness that many people complain of. Again, very nonspecific, but encephalopathy is really a truly prolonged state of altered mental status that can be really due to any infection, but some cases certainly have been reported with COVID-19. Some other fortunately rare but likely related dramatic presentations are ADEM, or acute disseminated encephalomyelitis, where there's very severe demyelinating changes in both children and adults. And this is usually, again, associated with some infection, multiple ones in the past, but certainly can add COVID-19 to that list. And a similar but also pretty awful condition called acute hemorrhagic necrotizing encephalopathy, a similar likely demyelinated autoimmune condition that can be triggered by a viral infection, but now also has a hemorrhagic component to it as well, and usually has fairly poor outcomes. And I'll mention Guillain-Barré syndrome. This is really the prototypical example of a disorder neurologically that you can get certainly from having infection with SARS-CoV-2, COVID-19, but also is emerging as a possible signal for an adverse reaction for some of the vaccines that are out there. So again, they're both involved, both whether it's a vaccine or the natural infection can alter your immune, but even with the Guillain-Barré, I'll talk about that a bit more in a few slides. Still, vaccination is strongly preferred in terms of reducing overall disease morbidity. So you can't have a talk about neurological episodes or complications without talking about MIS-C. Though most MIS-C, I think most pediatricians are reasonably well aware of it and have seen patients. They present pretty dramatically with clear cardiac and other rheumatological type involvement. However, a good subset of these patients have other symptoms, including headache, altered mental status, and a more profound version of that frank encephalopathy. I'd say most patients with MIS-C do not have this, based on the fact that we do not get called as neurologists very often for MIS-C, but it's something that clearly does involve the brain. And if you talk to these patients later, again, they have these fairly difficult to evaluate, difficult to treat concerns, such as, again, as brain fog and other just cognitive issues and memory as well. So these are all important things, but it's really hard to know what they represent, and I'll come back to that point again in terms of our evaluation. So switching over to vaccines then, there again is various adverse reactions that are being tracked, I'm going to say, pretty closely, at least in the USA, by the CDC. We have almost too good tracking because anyone can look at a database and see what kind of events have been reported, and people have seized upon this database as being evidence of causative associations of vaccines with disease X, Y, or Z. You know, this is just a catalog. Anyone can put it in there. It's there so we can do surveillance and look for potential signals that emerge from vaccinations. And then when these reactions get reported, groups of experts from various parts of medicine, epidemiology, public health, the United States, with global contacts, will review it and see, again, based on how many people are being vaccinated, who's reporting what, try to make sense of it and see whether it's associated, which often is the case because many people are vaccinated and many people have disease and they don't always influence one another. But there is some clearly more likely causal associations with vaccines, and I'll mention again one of them here. Overall, I think I emphasized it before, but my perspective, COVID vaccines are incredibly well tolerated, incredibly effective, and we're also fortunate they were being developed as quickly as they were because the technology just happened to be in place for this pandemic for us to utilize it well. There are some exceptions, and most of these so far have occurred in adults, and not surprising because of the way vaccines were rolled out, though we do expect we'll see similar signals of vaccine side effects as more and more children, younger and younger, get immunized. So the two I want to highlight, and this was part of a CDC project that I was part of, was to look at Guillain-Barré syndrome, again, an autoimmune demyelinating disorder, which is a pretty classic presentation in neurology. Patients have some sensory symptoms, they lose reflexes, so areflexia, and then they have weakness, and so-called ascending paralysis is the classic presentation as more and more of your peripheral nerves get picked off by a demyelinating process. I mean, that can be triggered by a disease, it can be triggered by a vaccine that's seen before. But what was noticed is more and more cases of Guillain-Barré syndrome were being reported, and there seemed to be an excess number that were associated with the Janssen vaccine. I was part of a publication on this, and we very clearly said that there does seem to be an increased risk with the Johnson Johnson vaccine. However, if you look at the data in whole, it's clearly the case that you are much worse off not getting this vaccine and being exposed to COVID-19 with similar manifestations, including Guillain-Barré, as you are without it. But of note, we have this large database, and we could compare the rate of Guillain-Barré syndrome, not only how many people got it, but when they got it, how many days, for example, after the vaccination was given. And while it held up with Guillain-Barré and another condition called thrombosis with thrombocytopenic syndrome, or TTS, we did not see that with the mRNA vaccine. So again, this tells us there's maybe a little more specificity here. If it was something that's just in the background that we picked up through surveillance, you expect it to be fairly homogeneously distributed amongst all vaccines. But the fact that it was really only associated with the Janssen vaccine led to a recommendation that people at risk for Guillain-Barré or TTS probably should avoid it, instead using the mRNA vaccines, the Moderna and the Pfizer instead. So that was an important epidemiological finding. And the reality is also in the United States, due to also myocarditis concerns, the Janssen vaccine is being used much less than the mRNA vaccines. But at least for neurological complications, you can say with some reasonable scientific data that Guillain-Barré seems to be more likely to be seen with the Janssen than any other vaccine. So other neurological manifestations, I mentioned Guillain-Barré down here, but we also saw for these patients that they had other presentations. There's a version of this called the Miller-Fisher syndrome, which I won't go into details, but has other cranial nerveopathies involved as opposed to the rest of the body as well. And then Bell's palsy, if you think about a Bell's palsy or a seventh nerve facial weakness, there's definitely case reports of that, and it can be associated with Guillain-Barré or it can be an isolated finding. And I don't think we know yet about whether this is, again, a causal or associative finding with various vaccines for COVID-19. And again, just having COVID-19 itself will lead to some patients presenting with a Bell's palsy. So whether you have more risk with the vaccine or less is unclear, but overall the sense is you probably have less risk if you're vaccinated than you do against a natural disease. So the point is that some Bell's palsies could be associated with Guillain-Barré because they also represent demyelinating disorders. And another demyelinating disorder that's usually thought of with younger folks who may develop multiple sclerosis in the future is a condition called transverse myelitis, which again is a demyelinating disorder. It affects the spinal cord. And it can again be the presenting symptoms of someone who later in life will then clearly have multiple sclerosis. So far, the data doesn't suggest there's any clear signal between transverse myelitis, but these are being tracked closely because, again, any vaccine, any disease can cause sort of an autoimmune inflammatory response, and some patients will present with transverse myelitis, and we don't know whether it's due to some community-acquired infection or something else, but so far I would say the data does not support any vaccine causing transverse myelitis. So these are a little more of the clear presentations of neurological issues. Some of the less clear ones on the next slide here are the subjective concerns. And because we do have this fairly robust post-approval surveillance program in the United States, and anyone can say, I had a side effect to this vaccine or I have a concern for a side effect, we get a lot of cases. And as a neurologist, and for your patients too that you might see, these can be very hard to tease out. Why? Because they're fairly subjective. I have tingling in my hands, I have sensory loss, I am weak, and we take these things seriously, but they can be very difficult to both diagnose and evaluate from there. One thing that is becoming apparent, and we don't want to overstress it because it's really a diagnosis of exclusion, the world is seeing much more functional neurologic disorders. These have various names, and this is the current name that people think is the best in 2022. But these are also called things like conversion disorders, somatization syndromes. It is not surprising to me or to anyone that in a pandemic for multiple years, anxiety issues, depression, mental health in general is really being pushed to its limits, as well as our ability to care for these patients. So having a functional disorder seems likely, and there has been, again, seems to us a large increase in the number of patients who present for various types of functional neurologic disorders. And some of them are healthcare providers. And to me, it makes a lot of sense that if you're a healthcare provider, maybe no more than the average person, and you get a vaccine and you're so worried about whatever, and you develop some complication, some sensory loss, some weakness, on that list of possibilities should be a functional neurologic disorder, because we look at these cases very hard, we work them up very seriously, and we often cannot find any objective cause of their symptoms. It doesn't mean it's not real or it's not there. It's just you have to consider there may be a stress component or something else going on which underlies these functional neurologic disorders. These are whole topics unto themselves, but I think it's fair to say that the COVID-19 pandemic has led to a pandemic also of functional neurologic disorders, and it's just part of the world we're in right now. So let's talk about long COVID. This is a hard one again for neurologists because, again, it's certainly by us poorly defined and poorly understood. The symptoms are very non-specific and nondescript. Fatigue, depression, memory problems. Who doesn't have these things sometimes? But it's those patients who have the persistent, long symptoms, cognitive issues. They often present to our cardiology colleagues or to sports medicine, people who can no longer function the way they used to be. And I think it's very hard to tease out whether this may be related to a depression caused by these diagnoses or some underlying COVID-related manifestation. And this is something that, of note, you can possibly treat long COVID with a vaccination against SARS-CoV-2, which I don't know, again, whether that could be a placebo effect or some additional benefit, but some people then postulated it could represent, again, more of a persistent infection with the coronavirus that's then leading to these, again, poorly defined but concerning symptoms that involve the brain and other organs. Hard to know, but again, I think you need to be a very open-minded, inclusive physician. Think of the history of what's going on, acknowledge the fact that we're in a stressful world and it's not changing anytime soon enough, and then various other symptoms that may not be as organic as we're used to thinking about could be there that still need to be addressed and supported. So that's where we're at in 2022 with neurological complications for both COVID as well as COVID vaccines. So shukran lek. I hope to see you all next year, God willing, and then I will see you later, I think tomorrow, for my next talk. So thank you very much. Take care.